Mr. Chair, and thank you to our witnesses for your testimony. Dr. Harris, your testimony references, when you look at the need for, as we look at the seniors and the changing demographics, the need for people to take care of seniors. And pretty soon there's going to be no one to take care of grandma in the middle of Nebraska at our assisted livings, and we're going to have issues, and already do, in rural hospitals and the like. So that bill, I remember it because Grover Norquist was one of my witnesses at this very committee, because he supported the bill because it reduced the debt, and it showed back then that the bill would have increased GDP by 3.3% and cut the deficit by about $900 billion over 2 decades. I will admit these are 2013 figures, but I think we could imagine the same thing now. Could you talk about how similar legislation could have the same effect now?
So economists don't agree on a lot, but we do agree on the benefits of immigration reform. And survey after survey of economists support that statement. And from the perspective of caregiving, I mean, there's almost too many benefits of immigration to list. We see increases in patents. We see decreases in prices. As we start to be selective about what types of workers we let in to address certain workforce gaps, we start to see less type specific labor markets. So for example, we have gaps in caregiving centers, as you referenced. The caregiving crisis, I do consider it a crisis, has 2 primary effects as older Americans are subject to a lack of caregivers. The first is higher prices for caregiving. As you have a shortage in those caregivers, they can demand much higher prices. The second is that unpaid caregivers increasingly bear the burden, and we're basically talking about middle-aged women bearing this burden right at their peak earning years. It has enormous consequences for the labor market in general and for these families in particular.
Okay. Can you talk about the positive effect that immigration reform could also have on Medicare and Social Security solvency?
Yeah, so when we're talking about these major programs, as we have younger people coming in their workforce, in their working lives, and they're paying into these programs, we're talking.
In your testimony, you talk about costs for healthcare programs and rising costs. One of the things that we've been working on a bipartisan basis out of the Judiciary Committee is how to reduce prescription drug costs. We already have the negotiation going on with Medicare. It's a bill that I led for many, many years, and we have the first 10 drugs on the being negotiated now. I will note that those 10 drugs, which includes Januvia and Jardiance and Eliquis, and I like to say these names because I memorize them. Those 10 drugs, 9 million seniors last year, they shelled out $3.4 billion in out-of-pocket on those 10 drugs alone. And you can imagine what we could do with more negotiations. But there's also patent issues with generics being kept off the market, and all kinds of things with the way the pharma companies are playing with patents. Could you talk about how that could help with reducing costs for healthcare spending?
So on that answer, I'm going to have to say I would be happy to talk to you about that when I have the right people in the room. I'm not a healthcare expert, and so I wouldn't want to speak on that issue.
Does anyone want to add to that as we look at costs? Okay. It's just, I think as we look at this deficit issue, it's just one of the driving forces. So keep it in mind as you keep working on these issues. Really appreciate your work. Thank you.
Senator Welch.